Hello, my name is Julie Burden and I work in the DESMOND National Head Office team at the Leicester Diabetes Centre. Today I'm going to be talking about the work we've been doing around the adaptation of the DESMOND Programme for people living in the deaf community. The DESMOND Programme is one of many diabetes self-management education programmes, and evidence already exists to show that these programmes help people manage their diabetes and help prevent future complications. And the National Institute for Health and Care Excellence recommends people should be referred to these diabetes education programmes. And their guidelines state that the programme should support the person to develop skills, beliefs, knowledge and attitudes that facilitate self-management. They should also be underpinned by theory and evidence and ultimately suit the needs of the person. This includes people living in the deaf community with type 2 diabetes. And in the UK, the total number of people who use British Sign Language, not necessarily as their main language or in a professional capacity, is estimated to be around 151,000. And of those, 87,000 people are deaf and British Sign Language is their preferred language. However, there is enormous variation in the available estimates, making it difficult to plan appropriate support and service provision. The Sign Health Report in 2014 found poorer health, diagnosis and treatment and management for people from the deaf community. And the report stated that this was probably largely caused by poor access to services and information and poor communication. The report also estimated that misdiagnosis and poor treatment for British Sign Language users was costing the NHS around £30 million a year. People in the deaf community can have limited access to health education due to the need for British Sign Language interpretation, and the report found that people in the deaf community had a similar rate of diagnosed diabetes as the rest of the population. But over half of them with known diabetes had high fasting blood sugar levels, suggesting that their diabetes was not being properly controlled. There could be several reasons for this, but poor communication, poor access to information could be leading to medication errors or inadequate patient education in diabetes self-management. Whatever the causes, it suggests that more needs to be done to ensure that people from the deaf community fully understand their condition and how to manage it. The Accessible Information Standard set out in 2016 is a legal obligation that aims to make sure that people who have a disability, impairment or sensory loss receive information that they can access and understand, and they are supported in their communication needs. Therefore, it aims to ensure that people from the deaf community have the same level of access to information about their health as hearing people do. This standard applies to all NHS, adult social care and publicly funded services. But 5 years later, a review found that 77% of people with accessible information needs reported rarely or never receiving information in alternative formats. So therefore, we've worked with a group of individuals in the Greater Manchester area to identify what was needed for DESMOND to meet the needs of individuals from the deaf community. And with the help of project officers from the NHS Greater Manchester Integrated Care and the staff and participants of the Manchester Deaf Centre, a group of interested individuals living with type 2 diabetes from the deaf community attended a discussion group. They shared their experiences of accessing healthcare services, but also gave feedback on the DESMOND Programme, including its format, timings, resources, and the style that it is delivered in. Some of the main themes identified included the venue and environment of where the DESMOND sessions should be held, the number of participants in a session to allow for complete interpretation time and discussions, the structure and timings included the need for extended breaks and additional reflection time to allow for recap of key messages, and finally working with the British Sign Language interpreters themselves, where the same qualified and registered interpreters should be used each time to build on good working relationships. Following these discussions, guidance documents have now been developed, including one for the British Sign Language interpreters, so that they can receive key information in advance of interpreting a DESMOND programme. It provides an overview of each of the sessions within the programme and what resources are used within the course, as well as a glossary of terms to aid with preparation and then interpretation on the day. In addition to this resource, an educator's toolkit has also been developed, which covers considerations for accredited educators delivering DESMOND to the deaf community, including things around the practicalities, timings, as well as group education facilitator behaviours that are needed when delivering with interpreters. The toolkit has been finalised and used in delivering DESMOND to the deaf community back up in the Manchester area, and a workshop has been created to upskill existing accredited educators so that the toolkits can be shared and learning passed on by the DESMOND head office team that have been involved in this adaptation project. This work is now being rolled out to DESMOND sites around the UK and Ireland, and we are now looking at what adaptations are needed for the DESMOND programme when being delivered to people living with type 2 diabetes with a visual impairment. For further information, please contact the DESMOND head office team on the email provided. Thank you.